Hello friends, I am Mrs. Inuka David and I am going to explain mental health questions. Shall we start? Are you ready? Okay. First question. A 5 years old patient diagnosed as rectal cancer and his response to the diagnosis is that nothing is wrong, it is just hemorrhoid. Which defense mechanism is used? Options are denial, repression, projection, and displacement. So let me explain you what is defense mechanism and what are these techniques used. So defense mechanism are the methods of attempting to protect self and cope with basic drives or emotionally painful thoughts. The purpose is to reduce or eliminate anxiety. तो डिफेंस मैकेनिज्म वो टेक्निक होता है, मेथड होता है जिससे हम अपने आप को बुरी विचारों से और बुरे दर्दनाक घटनाओं से हम अपने आप को दूर रखने की कोशिश करते हैं जिससे कि हमारा घबराहट कम हो जाए। इसमें जो टेक्निक्स हैं वो है डिनाइल। डिनाइल में क्या होता है कि रिफ्यूज़, अनकॉन्शियस रिफ्यूज़ल टू एडमिट एन अनएक्सेप्टेबल आइडिया और बिहेवियर। The person just refuses to experience it. ओके, इसमें क्या है कि अपने आप को उस घटना के बारे में आप एक्सेप्ट करने के लिए या उस दर्दनाक घटना को एक्सपीरियंस करने से मना करते हैं। डिप्रेशन में अनकॉन्शियस एंड इनवॉलेंट्री फॉरगेटिंग ऑफ पेनफुल आइडियाज, इवेंट्स एंड कॉन्फ्लिक्ट्स। ओके, projection, unconsciously blaming someone else for one's difficulty. And displacement is an unconscious discharging painful feelings to a less threatening object. डिस्प्लेस कर देते हैं, मतलब जैसे सपोज बॉस के साथ कुछ ऑफिस में कोई बात हो गई तो घर आके किसी चीज़ पर उस गुस्सा को उतारना, दैट इज़ कॉल्ड डिस्प्लेसमेंट। सो आंसर इज डिनाइल। इसमें यहाँ बच्चा जो है अपने आप को डिनाई करता है कि मेरे को रेक्टल कैंसर है करके। ओके, सेकेंड क्वेश्चन, delusion is a disorder of, options are insight, thought, cognition and perception. So delusion is a false, fixed, unshakable belief. So it is the disturbance of thought content. Okay. Question number 3. Preoccupation with the fear of having a serious physical illness but based on real or organic is not based on real or organic pathology is option hypertonicity, hyposthesia, hypochondriasis, psychosomatic disorder. Hypertonicity means abnormally increased muscle tone or strength. Hyposthesia means is a medical term for partial or loss of sensation in a part of your body. Hypochondriasis or hypochondria is a condition in which a person is excessively or unduly worried about having a serious illness. Or psychosomatic disorder is a psychological condition involving the occurrence of physical symptoms usually lacking a medical explanation. Okay. So people with this condition may be having excessive thought, feeling or concern about the symptom which affects their ability to function well. ठीक है, हाइपरटोनिसिटी मतलब कि मसल टोन जब इंक्रीज हो जाता है। हाइपोथीसिया मतलब कि पार्शियल या टोटल लॉस, किसी बॉडी के एक पार्ट में सेंसेशन लॉस हो जाता है। ओके, सो यहाँ इसका आंसर है हाइपोकॉन्ड्रियासिस। ओके, fourth question. Common form of ECT used in the hospital is, ECT क्या है? Electroconvulsive therapy. Where electricity is induced into the brain cells in order to produce a artificial conversion. It is a form of treatment, physical treatment for the psychiatric mental disorder, mainly for the patients having depressed, having suicidal thoughts. Okay, so it was of two types: direct ECT and modified ECT. Direct ECT means ECT is given without the use of anesthetic drug and muscle relaxant. Whereas, as the time passed, the ECT was modified by using short-acting anesthetic agent and muscle relaxant. So, and which is a safe, and the complications like dislocation of ball and socket joints and the movable joint and tongue bites and ये सारे कॉम्प्लिकेशन कम हो गए. तो इसीलिए अब जो ऑप्शन है क्या क्या देखें: डायरेक्ट ईसीटी, मॉडिफाइड ईसीटी, बोथ ऑफ द अबव एंड नन ऑफ द अबव. क्या हो सकता है? बी, मॉडिफाइड ईसीटी. कॉमन फॉर्म पूछ रहे. ओके, नेक्स्ट क्वेश्चन. With barbiturate and benzodiazepine abuse and dependency, sedative intoxication is generally associated with. बताओ, ऑप्शन बोलो पहले. ऑप्शन इज uncoordinated motor movement, slurred speech, impairment in attention and speech, and all of the above. क्या हो सकता है? बेंजोडाइजेपिन सेडेटिव्स होते हैं, है ना. और अगर इंटॉक्सिकेशन हो तो ड्राउजी हो जाएगा पर्सन, है ना. And the person is drowsy, the person will have uncoordinated motor movement, slurred speech, impairment in attention and speech. So answer is all of the above. Question number 6. Catatonic behavior in schizophrenia is characterized by which of the following? Options: resisting attempt to be moved, maintaining rigid immobile posture, decrease in reactivity to the environment, all of the above. So catatonic या catadisturbed schizophrenia is characterized by mass disturbance in the motor behavior. Okay, this may take the form of stupor or excitement or and catatonia, alternating between excitement and stupor. So excitement catatonia में increased psychomotor activity होता है, increased speech production होता है, loosening of association, okay. और retarded catatonic या catatonic stupor में mutism, absence of speech, rigidity, maintenance of rigid posture against the effort to be moved, negativism, emotiveness, resistance to all the command and attempt to be moved or doing just the opposite. Okay, posturing, stupor, echolalia, echopraxia, waxy flexibility, ambitendency and automatic obedience. Ambitendency मतलब है ये conflict to do or not to do. जैसे अगर हम किसी पेशेंट को बोलते हैं अपना जीभ निकालो तो वो थोड़ा सा निकाल के फिर अंदर रख लेंगे. सो दैट इज कॉल्ड एम्बिटेंडेंसी. ओके, सो इसका आंसर है maintaining rigid and immobile posture. Okay. Question number 7. Which of the following describes relationship of a client with a histrionic personality? अब बताओ, हिस्ट्रियोनिक पर्सनालिटी क्या होता है? अटेंशन सीकिंग पर्सनालिटी या अटेंशन सीकिंग बिहेवियर. ठीक है. दे आर ड्रॉन टू मोमेंट्री एक्साइटमेंट एंड फ्लीटिंग एडवेंचर्स. ओके, सो इनका जो सिम्टम होता है वो ड्रामेटिकली इमोशनली ब्लैकमेल करेंगे, एंग्री स्क्रीन्स डेमोन्स्ट्रेट करेंगे, सब चीज़ें. ओके, craving for novelty and excitement, shallow and labile affectivity, attention seeking behavior, over concern with physical attractiveness, impulsivity, suggestibility, ego सेंट्रिसिटी, ये सारी चीज़ें होती है. अब देखिए ऑप्शन क्या क्या है. कोल्ड एंड डिस्टेंट, शैलो एंड स्मूथरिंग, क्लोज एंड क्लिंगी, डिस्ट्रेसफुल एंड जेलस. कोल्ड एंड डिस्टेंट होते हैं सीजॉइड पर्सनालिटी. ठीक है. डिस्ट्रेसफुल एंड जेलस, पैरानाइड. ओके. क्लोज एंड क्लिंगी, and this okay, shallow and smoothing. Okay, answer is shallow and smoothing. ठीक है. स्ट्रोनिक पर्सनालिटी है shallow and smoothing. Question number 8. A nurse is assessing a client with narcissistic personality disorder. Nurse anticipates the client's behavior to be characterized as which of the following. नार्सिस्टिक बिहेवियर होते हैं. इसमें क्या होता है कि ये सेल्फ सेंटर्ड होते हैं, सेल्फ एब्जॉर्ब होते हैं, लैक इन एम्पैथी फॉर अदर्स. ओके. सो ऑप्शंस आर grandiose and entitled, submissive and clinging, impulsive and unstable emotionally, provocative and seductive. So answer is grandiose and entitled. Okay. They describe the pattern of narcissistic personality disorder. ठीक. विश्वास करती हूँ कि अभी तक आप लोगों को समझ में अच्छी तरह आ रहा है. क्वेश्चन नंबर 9. नेक्स्ट क्वेश्चन. Which nursing intervention has priority for a client with borderline personality disorder? Okay. So borderline personality is marked by the pattern of instability in interpersonal relationship, mood, behavior and self-image. Okay. So options हैं यहाँ पर देखें. मेंटेन कंसिस्टेंट एंड रियलिस्टिक लिमिट. अब इसको कैसे नर्सिंग इंटरवेंशन बोल रहे हैं. ओके. Give instruction for meeting the basic self-care needs, engage in daytime activities, stimulate wakefulness, have the client attend to group therapy on a daily basis. तो इसका आंसर है मेंटेन कंसिस्टेंट एंड रियलिस्टिक लिमिट. Next question. Question number 10. Thought process characterized by a series of ideas without apparent logical connection is referred to as loosening of association, flight of ideas, confabulation, tangentiality. Okay. So, here is the thought process characterized by a series of ideas. There are many ideas, but they are not logically connected. So, that is called loosening of association. Question number 11. Which among the following is not a short-acting benzodiazepine? Options are lorazepam, diazepam, oxazepam, helprax. ठीक है. लोराजिपाम, ऑक्साजिपाम, एल्प्रेक्स, ये तीनों तो शॉर्ट एक्टिंग बेंजोडाइजेपिन है. और डाइजेपाम है लॉन्ग एक्टिंग बेंजोडाइजेपिन. ओके. आंसर इज डाइजेपाम, नॉट ए शॉर्ट एक्टिंग बेंजोडाइजेपिन. ओके. ध्यान से पढ़ना है. क्वेश्चन नंबर 12. Which of the following are risk factor for childhood psychiatric disorder? Psychopsychiatric disorder is due to mother-child not no improper mother-child relationship. ठीक है. So parent and the child relationship is not proper, then the child develops childhood psychiatric disorder. So options are harsh or inadequate parents, parental psychopathology, repeated early separation from parents, broken homes. Okay? And last is all the above. Answer is all of the above. 13. Autism. ऑटिज्म एक चाइल्डहुड डिसऑर्डर होता है और इसमें एलूफनेस होते हैं, अनरिस्पॉन्सिव टू पेरेंट्स, अफेक्शनेट बिहेवियर बाय स्माइलिंग और कडलिंग, gaze avoidance or lack of eye-to-eye contact, dislikes being touched or kissed, no separation anxiety or being left in an unfamiliar neighborhood stranger. ठीक है, सो ये सब चीज़ें होती है ऑटिज्म में. ऑप्शन देखें हम लोग. सोशल एंड लैंग्वेज कम्युनिकेशन प्रॉब्लम होता है, मेनली ड्यू टू हाइपोथैलेमिक डैमेज, neurodevelopmental disorder, metabolic disorder. Answer is social and communication problem. 14th question. A patient who decides to leave the hospital against medical advice, that is LAMA, must sign a form. What is the purpose of this form? Options: to use in the event of readmission, to reduce the physician and hospital from legal responsibility for the patient's health status, to indicate the patient's wish, to ethically illustrate that the patient has control of his or her own care and treatment. ठीक है. लामा तभी जाते हैं जब पेशेंट्स और पेशेंट के रिलेटिव्स पेशेंट के हेल्थ कंडीशंस के लिए सेटिस्फाइड नहीं होते हैं by the hospital or physician side. So they want to leave or they want to have some other consultation or go to some other hospital, then they will leave the hospital against the medical advice. So answer is B and C. That is to release the physician and hospital from legal responsibility for the patient's health status and to indicate the patient's wish. Okay. 15th question. The term psychiatry was first given by John Christian Rale, Benjamin Ford, Alison Grimacis, Joseph Lister. The answer is John Christian Rale. 16. Question number 16. A patient was admitted yesterday with an adjustment disorder and depressed mood has not left his or her room. The psychiatric mental health nurse most appropriate approach at the meal time today is to respond. Okay. Option देख. I will bring your tray to your room if you will. It will make you more comfortable. I will walk with you to the dining room and sit with you while you eat. Where would you like to eat your meal this afternoon? Or you will feel better if you go to dining room and eat with others. तो इसका ऑप्शन है I will walk with you to the dining room, sit with you for a while, sit with you while you eat. ठीक है, assurance है. 17th question. A supervisor observes inconsistency in the psychiatric mental health nurse behavior towards a patient. The nurse is unreasonably concerned, overly kind, and irrationally hostile. The most appropriate explanation is that the nurse is displaying options: countertransference, empathetic resonance, splitting behavior, or transference. Okay. Therapeutic impasses that block the progress of a nurse patient relationships में काउंटर ट्रांसफरेंस होता है और ट्रांसफरेंस होता है. ठीक है. काउंटर ट्रांसफरेंस में is a specific emotional response by a nurse to the patient that is inappropriate to the content and context of a therapeutic relationship. Whereas transference is unconscious response in which the patient experience feeling towards the nurse. Okay. So transference में क्या है, पेशेंट नर्स के प्रति उसका एटीट्यूड और फीलिंग्स एक्सपीरियंस करते हैं। काउंटर ट्रांसफरेंस में नर्स जो है वो पेशेंट के लिए फील करती है। तो यहाँ क्वेश्चन क्या बोलता है कि एक सुपरवाइजर ने ऑब्जर्व किया कि एक नर्स जो है पेशेंट के लिए बहुत कंसर्न होती है। सो आंसर इज काउंटर ट्रांसफरेंस। Question number 18. The severe feeling of restlessness produced by some psychotropic medication, which is often misinterpreted by patients as anxiety or a recurrence of psychotic symptom, is known as options देखें पहले akathisia, kinesia, bradykinesia, dystonia. ठीक है। EPS या extra pyramidal symptom, which is the side effect adverse effect of psychotropic drugs, is are akathisia, bradykinesia, neuroleptic symptoms like neuroleptic symptoms like Parkinsonism, ये सब चीज़ें होती है। ठीक है। तो इसमें क्या है कि डिस्टोनिया तो होता है कि स्लो sustained muscular spasm that lead to involuntary movement, और akathisia होता है कि इसे subjective feeling of muscular discomfort that can cause patient to be agitated, restless and feel generally dysphoric. Okay, so ये आंसर इसका आता है akathisia. Question number 90. The ability to understand one's own behavior and emotion is called judgment, insight, intelligence, personality. आंसर क्या है? इंसाइट। ठीक है। जजमेंट नहीं होता, जजमेंट मतलब न्याय करना। इंटेलिजेंस किसी की क्षमता, जो लर्निंग एंड इंटेलिजेंसी। ठीक है। पर्सनालिटी किसी का नेचर एंड स्वभाव और फिजिकल, ये सब आ जाते हैं। तो आंसर इज insight. Insight is to understand one's own behavior, ability to understand one's own behavior and emotions. Question 20. Fear of pain is termed as, बोलो भाई। ऑप्शन देख पहले। एल्गोफोबिया, जूफोबिया, एगोराफोबिया एंड जेनोफोबिया। ठीक है। जेनोफोबिया इज fear of strangers. And agoraphobia, fear of being in a being in a place away from a familiar setting of home or somewhere. Zoophobia is fear of animals. ठीक है। Algophobia is the fear of pain. So answer is algophobia. Hope you all enjoyed and understood. If you enjoyed it, do like to share, like it and share it. Thank you.